Hello, all. Today, I welcome all of you to another episode of Study with Me NCLEX edition. Today, we're going to discuss about hypothyroidism. We'll discuss about thyroid gland, its anatomy, and its physiology. It is an important topic if you want to ace your NCLEX RN examination in your first attempt. So let's begin to understand what is hypothyroidism. Now, before hypothyroidism, before we understand what this condition is, we need to understand how does it cause and what's the anatomy of thyroid gland. So as you can see it on the screen, this is the gland what we are talking about. So it is a butterfly shape organ which is situated just below your larynx. So this butterfly shape is known as thyroid gland. So this I've highlighted the part. This is the thyroid gland. And behind or on the back side, on the posterior side of the thyroid gland, you can see parathyroid glands. So these glands are very important or essential in your daily living or carrying out normal metabolism or normal physiological functions in your body. Let's understand what is this thyroid gland responsible for. Now, this is responsible for hormone productions that play a vital role in body metabolism, temperature regulations, and growth hormones. This also affects your mood. So that becomes an indicator many a times when you see altered mood, when you see your metabolism is going down, you're gaining weight, you cannot bear cold temperature. Those are the signs for you to check for your TSH level or check for your T3 or T4 levels. Now, what about these parathyroid glands? Now, these are the glands responsible for regulating calcium levels in your body. So, both these glands are very important. It is an essential part of your body which helps in normal physiological functions of your body. Now, what happens with this thyroid gland is it generates T3 and T4 hormones, and these hormones cannot be built in your body without iodine. So iodine is directly linked. So it need to be absorbed from the food. You cannot give an external supplement of iodine. It's always better you eat enough salt, because in our country, if you check, and even in the US, normally the table salt that we get, it is instilled with iodine. So that helps in absorption and that helps in generating T3 and T4 in your body. Now, what are the functions of these hormones, T3 and T4? The major function is it helps you to digest your food. It helps in calorie management in your food. Also, the entire cells in your body which give up, which dies, all the dying cells are replaced. It helps in quick digestion of the foods. Also, it stimulates your sympathetic nervous system, which means your alertness, your response reflexes, your mood, everything is controlled by these hormones generated or produced by thyroid gland. So it becomes an essential and integrate part of your physiological functions, of your mind, of your body, everything. So that's the reason it becomes an important topic. If you are writing your NCLEX RN examination and you want to ace it in first attempt, you need to understand these physiologies in your mind. So how does this happen? So there would be a mechanism, there would be a physiology which would be involved, which would ultimately produce T3 and T4 hormones. Let's understand that. Let's understand the physiology of T3 and T4. I try to make it simple. I will try to make it in three simple steps so that you understand how does it work. So everyone is aware of this part of the body, which is hypothalamus. So what does this hypothalamus do? We know hypothalamus is also responsible for controlling the temperature in our body. Now, how does it do that? Hypothalamus generates a hormone known as thyrotropin releasing hormone, which stimulates your pituitary gland. And when pituitary gland is stimulated, it brings out thyroid stimulating hormone. And these thyroid stimulating hormone facilitates or stimulates the thyroid gland to produce T3 and T4. So this is a combined response which you need to understand. So hypothalamus feels like, okay, this particular function has to be done in the body. Like for example, a temperature has to be controlled. For example, dying cells need to be replaced. So hypothalamus knows what kind of hormone should I produce, or whom should I stimulate, or which part of the body, or which organ of the body, or which gland of the body needs to do its work. So your hypothalamus start releasing TRH, which ultimately stimulates the pituitary gland. Pituitary gland stimulates the thyroid gland to produce T3 and T4. That's the reason many a times if you see a patient with pituitary gland tumor will have a trouble with T3 and T4, will have a trouble with thyroid hormones. The reason is there are no adequate TSH are produced, which ultimately stimulates thyroid gland for T3 and T4. Or if there is a trouble like a thyroidectomy or a pediatric patient who has undergone a thyroidectomy, there is a trouble with the gland, you would see there would be a high level of TSH because your body is trying to compensate. Your body is trying to push the mechanism to generate more T3 and T4. So that's a reason sometimes due to various reasons, patient may suffer hypothyroidism. And how do you understand that? Whether a patient is suffering with hypothyroidism, these are the points which you can note. You can see many a times, as I told you in the beginning, T3 and T4 is highly responsible for managing calories in your body or for managing digestion, metabolism. Everything comes into picture. If that is hampered, automatically the patient will have weight gain because there is a low calorie burn. Since these T3 and T4 are also responsible for temperature management in your body. These patients will not be able to tolerate much cold. They would always complain, I'm not able to bear this. Can you switch off the phone? Can you switch off the AC? Can you switch off the fan? I cannot bear this. The reason is their tolerance level has gone down because the body is unable to raise the temperature. And sometimes, due to thyroidectomy or many other reasons, thyroid, even though after stimulating so much by pituitary gland, by stimulating a lot of hormones, still patient is unable to generate T3 and T4. In that scenarios, you will see there would be a hump kind structure in their neck region where the larynx, the Adam's apple below that you will see there is a bulging. That is a possible goiter because anterior pituitary gland is constantly poking thyroid to build more T3 and T4, which is not happening due to some disruptions. And continuously, thyroid gland is being stimulated. And when the patient doesn't have enough T3 and T4, you'll always find those patients very tired and agitated. And even the heart rate won't have that function. So understand how important this gland, these hormones are. If these hormones are not generated adequate in your body, definitely there is going to be a slowdown. So hypothyroidism means low level of T3 and T4, which means many functions of your body is going to go down. So hypo, as the name suggests, everything is going slow and low. So if a question comes in your examination which is related to hypo, think there may be a scenario based questions, there may be a critical thinking based questions wherein the question is all about which one best describes that the patient is suffering with hypothyroid. So you should think, okay, calories won't be burned, there would be a weight gain, okay, there may be a bradycardia, patient may have a hump or bulging in their neck region, patient may complain of not able to tolerate cold climate. These kind of signs and symptoms are very common. So which is an indicator of you to understand that this patient may be suffering with hypothyroidism. Now, what should you do? What is an action if a patient is suffering with hypothyroidism? What action would you take? Let's come to drugs. The common choice of drug is levothyroxine. Now, these are certain pointers that you need to keep in your mind if a patient is on levothyroxine. You need to check for the TSH level, you need to check for the hormonal level in the body and then adjust the dose accordingly. So, for that, you will have to tell the patient to undergo a blood test. If you find the TSH level is too high, then that's the time to start levothyroxine, or if the patient is already on levothyroxine, you need to increase the dose. Always, this dose is going to be taken once daily and always on an empty stomach. So this is called as early morning drug. And why many a times there are questions based on this, why it is not taken in the evening time? Because this drug can cause insomnia. So that's the reason we don't give this drug at the bedtime. And usually, since this is a hormonal therapy, this therapy may last for lifelong. It can go forever. So it is usually a lifelong therapy. And the minimum time, so there are many questions I've seen in NCLEX RN which says that patient is not feeling any benefit after a month. What advice should be given? The advice should be very clear, because minimum it takes up to, like, it ranges between 5 to 8 weeks to see the full effect. So it won't be immediate. So if a patient comes and see that, oh no, I don't feel anything is working for me, you need to calm down the patient and educate the patient that it may take up to 8 weeks to see the full effect. And how do you understand whether the drug is working for the patient? Very simple. You will see patient started increased sense of well-being. Patient has great energy levels and heart rate has come back to normal. So if you understand what causes this condition and what would be the symptoms of this condition, then understanding how the patient has improved will be very easy. So every topic when you learn in NCLEX RN, you need to understand the physiology, you need to understand the anatomy well, how it functions, you need to relate it with your own body. Then you won't forget the concept. The concept has to be clear in your mind. I hope this lesson was productive. You have learned something from this. If you want to learn more like this, follow and subscribe our channel today.